Hi everyone, I'm Dr. Sido. Today we've got a very interesting topic. We're going to be talking about anesthesia. I've got Dr. Sido, a private anaesthetist in Sydney who works in the areas of neurosurgery and bariatric surgery. So thanks so much for joining me today, Aj.
Thanks so much, Shiva.
Now, my understanding is anesthesia involves the management of awareness, breathing, hemodynamics and pain. Is that correct?
Spot on.
Alright, so my first question for you is really about awareness. How do you ensure that patients are not going to be aware of the surgery when it's occurring?
It starts when we first meet the patient in the anaesthetic bay. We bring the patient in and induce a state of anaesthesia and monitor physiological variables and have a margin of safety in all our decisions and monitoring so we can make sure that we can treat it before you experience it.
So can you explain what you mean by the physiological variables?
That's right. So by that we mean your heart rate, it might increase, your blood pressure might increase, and brainwave activity monitors, which we can look at and gives us further information to make sure that you will not remember your operation.
And are you looking at those factors preemptively?
That's right. So we're monitoring it the whole time. We're dosing more than what's required, but safe enough so that your risk of awareness is very low.
And how do you calculate the dose of anaesthetic someone needs?
That's right. So we look at the patient, your height, your weight. We look at any comorbidities you have. That allows us to give those medications safely. And we look at the type of surgery and the duration, which allows us to induce a state of anaesthesia and also allows us to wake you up at the end of operation safely and pain-free.
So you've taken care of awareness. What about breathing? What is the patient doing with breathing?
That's right. For some operations which are short duration and not particularly painful, you can breathe for yourself. But for other operations which are complex, you will require to be connected to a ventilator. Now we do that safely by inserting a breathing tube under a deep state of anaesthesia and connecting you up to the ventilator, which breathes for you. But we still have to monitor the ventilator, Shiva. We look at your oxygen levels, we look at your respiratory function, we look at your carbon dioxide levels. We want to make sure there's adequate oxygen delivery from your nose to your toes.
Which brings us to hemodynamics. Can you explain that for us?
That's right. So all that oxygen that's coming in has got to travel throughout your whole body. So we have to make sure that your heart rate is close to its normal awake level, that's before you're under an operation or anaesthetic, and your blood pressure is again close to your normal awake level. Also, we found that not only would that mean that you're not aware and your pain's well controlled, it'll actually lead to a smooth and quick and safe recovery from your surgery.
So the last question is really about pain, probably the most important part. How do you ensure that a person's not experiencing pain during the surgery? How do you calculate their pain requirements?
That's right. So we estimate your pain requirements on your physical factors, as we discussed, like your height and your weight and any other comorbidities. We also look at your previous analgesic requirements and continue your medication. And then during the surgery, we treat it with medications, which may also include local anaesthetics. So when you wake up after the surgery, you won't have any pain.
And during the surgery, what signs are you looking out for to monitor whether a person's experiencing any pain or might be about to experience pain?
Time is a factor. We know when the medications work and we treat it before you experience the pain. We also look at your heart rate, which will increase with pain, your blood pressure, which will increase with pain, and use those factors as well as our knowledge of the type of surgery to treat your pain and make sure you're not in pain at the end of your operation.
That's great. Thanks a lot, Aj.
Thanks so much, Shiva.